Hi guys, once again this is Mrs. Hall and this unit on oxygen therapy. You can find links to this video series Nursing 3101L in the description box below. Oxygen therapy is a treatment that delivers oxygen gas for the patient to breathe. You can receive oxygen therapy through tubes resting on the nose, a face mask, or a tube placed in the trachea or the windpipe. This treatment increases the amount of oxygen in the lungs and it also increases the amount of oxygen that's delivered to the blood. We do this to prevent tissue hypoxia, to aid in comfort of breathing, to improve the patient's ability to perform ADLs, and to prevent complications that arise from poor oxygenation. Room air is considered to be 21% oxygen. Anything above that is oxygen therapy. So consider oxygen a drug because there are significant complications that can arise from the use of oxygen, especially in the very young. A patient can experience oxygen toxicity, displaying intermittent stiffening, seizures, and it can also lead to death. This is most often seen in cases of high flow oxygen, like in a hyperbaric chamber or with divers. The pulmonary effects, though, can present as early as within 24 hours of breathing pure oxygen. Symptoms include pleuritic chest pain, substernal heaviness, coughing, and dyspnea secondary to tracheobronchitis and absorptive atelectasis, which can lead to pulmonary edema. More commonly, though, we would see dry mucous membranes of the nares, headaches, and nosebleeds. When administering oxygen, there are low flow options and high flow options. Low flow methods include things like the nasal prongs or the masks. High flow methods are like the non-rebreather mask or the Cherry system, the Venturi mask. The Venturi mask has valves that change the level of oxygen and is best used for COPD patients. There are several different colored tips that are interchangeable. So what we're going to do now is to talk about how to connect the oxygen. Your oxygen would have most likely two sources. One, you would have a wall unit, or two, you would have an actual tank that you need to connect to. To set up for the oxygen therapy, ensure that there is oxygen in the tank by checking the gauge. Wall units may not have visible gauges, but they're managed by the maintenance team. You would connect your humidifier bottle to the source by screwing that on. It's a bottle about 6 to 9 inches tall, and you would fill it with water, like about 3/4 of the way up. And then you would attach the bottle to a nipple, and then that nipple to your tubing. Your tubing comes with two ends that are like this. So one end will go to the source and one end will go to the exit, to where the patient receives the oxygen from. Now we'll discuss a little bit about cannulas. The nasal cannula is the easiest but most expensive way to deliver oxygen. It's easy because of its motility options and convenience, but it's also very expensive because of the amount of oxygen that gets lost just to the air. Here, you're going to see two different sizes. This one is the pediatric, and this one is an adult. There are several other sizes, but this demonstration is to show that the size of the cannula relates to the size of the nares in which you're going to put it. Another thing of note is you're going to notice that the adult one has a little tab at the top. So you're going to see that tab. That tab indicates the top of the cannula. We're not going to use oxygen by cannula much higher than 6 liters per minute. If it goes more than 6 liters per minute, you're really needing another source. You're needing a high flow source. So when you're hooking up a patient to a cannula, you may want to give them a tissue because at first getting used to the prongs inside the nose, it's just a little bit uncomfortable and it may cause a little bit of runny nose. So you want to give them that to make him comfortable. So you would set up your patient by turning the cannula in the correct direction with that little tab facing up. And then you are going to hook it over the patient's ear. Then adjusting the lock below the chin. This helps to keep the cannula in place. There are other forms of oxygen administration, and we are going to talk next about the mask. So this is our mask. This is a pediatric mask. It's a little bit tiny. So you are going to see that the mask has a hole on the side, on both sides. This hole is supposed to be there and is not supposed to be obstructed. These masks deliver 50 to 80% oxygen. And you know that's a very wide range, but we say 50 to 80% oxygen because they're losing a lot of the oxygen through these holes. This is the way it's supposed to be set up though. The flow for this can be up to 10 liters per minute, just because you're losing so much of it anyways. So to set this up, there's a nipple that goes to the end here that has a point, and then you're going to connect that point onto your tubing. Then connect your tubing to the source. That source would have your humidified bottle. So in order to get this on right, make sure that you have the correct size for your patient. This doll can use a small, so we will put the mask over the face and extend the straps over the head, adjusting the nose clip. Ensure that your patient is comfortable, and then they can remain with this breathing normally. Next, we can discuss issues of giving medications, because these, you may be familiar with them in terms of an asthmatic patient receiving medications. These little bottles come with 3 different parts. There's the top that attaches to the mask. There's the bottom that holds the fluid. And then there's that third little piece that helps to cause the aeration of the medication. Both of these have 3 parts, and you have to make sure that all 3 parts are together in order to make sure that it works. Otherwise, if you just have 2, it will not make that humidified medication. Usually when you attach these to oxygen tanks, it has to be at a very high flow. It has to be like 10 or 15, just in order to get it bubbling. That's why we normally use a machine that is specific for that purpose, that pushes enough air. But don't be surprised if you are ordered to give medication by your oxygen tank as well. Next, we will talk about the non-rebreather mask. This is a high concentration mask that delivers what we consider 100% oxygen. However, it's more like up to 80%, because the only way to really deliver 100% oxygen is with an ET tube. So you will notice that the mask on this is just a little bit different. This mask has smaller holes. There's usually a circular tab that goes over this, and that stops the air from going in. This is a rebreather mask. They are a non-rebreather mask. They are not rebreathing their carbon dioxide. So when they breathe out, that little flap raises a little bit and it lets that out. There is also another tab inside this one. See, this one has its little white tab. What that white tab does is to stop the air that the patient has breathed out from going back into the bag, because what they're doing is to breathe fresh oxygen each time they take a breath in. So in order to set this up, you are going to connect your tubing directly to the bag and then connect it to your oxygen source, which should be humidified. In some cases, it may not be, but humidified air is much better because it would prevent that nosebleeds and drying out of the nasal passages. So once you have this set up like this, you don't quite attach it to the patient yet. You need to turn that oxygen rate to flow somewhere between 10 and 15 liters per minute so that the reservoir bag is filled before you put it onto the patient's face. So once you've got this bag filled, now you can place it onto the patient's face in a similar manner to what we've done before. So now the patient will be getting air directly from the oxygen source that goes into this bag. When the patient breathes in, the little flap in here is going to raise, the bag is going to deflate, and the patient's going to get pure oxygen from this bag. When the patient breathes out, the little tabs here are going to lift and let out that air, and you're going to see the bag inflate. Why? Because new air comes in. So if you ever see your patient breathing in and your bag doing the opposite, then you know that you are going to have a problem and you're going to have to check if the tab is there. And your bag is supposed to never be completely deflated like this. So with that now, we've discussed several different options of oxygen therapy, things that will be commonly seen around the healthcare settings that you'll be working in. I hope that this helps you, and if you have any other questions, feel free to ask them as we go along. We'll see you for your next unit.